that requires everybody to make sure that they stay informed. Most particularly, we've got to make sure that our health workers are informed. We're also going to be working on protocols to do additional passenger screening, both at the source and here in the United States. All of these things make me confident that here in the United States, at least, the chances of an outbreak of an epidemic here are extraordinarily low.
All right, folks. So Thomas Eric Duncan, of course, passing away today from Ebola, the first person to die of Ebola here in the United States. He's the gentleman who came over from Liberia and went to Dallas. Joining us now, Dr. Jane M. Orient, Director of the Association of American Physicians and Surgeons, and author of a great book about the science behind the diagnosis, and it's Sapira's art and science of bedside diagnosis, I should say. Hello, doctor. How are you?
I'm okay.
All right. Are we okay, though? That's the question.
Well, we are more than halfway through the incubation period for Mr. Duncan's family, and so far we haven't heard of them getting sick. We're just starting the watch period for those who were taking care of him during his last days, and it's conceivable that up to 25 days from now we should start getting reports that one or more of them has become ill, just like that Spanish nurse
right,
who became ill while taking care of the priests in Spain, and even though she was using protective gear.
Yeah, now we're hearing that they want to put down her dog. Can dogs spread Ebola?
Dogs can acquire Ebola. They may not have any symptoms, and we're not really sure whether they can spread it, even though they're not symptomatic themselves. But this is a real problem, especially if somebody's like vomited in the yard and there may be some dogs around.
Yeah, oh boy. All right, let me ask you this, and I want to clear up the name. It's Sapira's Art and Science of Bedside Diagnosis. I apologize for mispronouncing the name at the beginning of your great book. Let me ask you, doctor, what should we be doing that we're not doing? I mean, the president now says it's highly unlikely. He also said it was highly unlikely there'd be a case of Ebola in the United States. Should the CDC, should the government be doing more than now planning to take the temperature of, at 5 airports of people coming from these countries? Or should we just stop people from coming from these countries altogether?
Well, we did take Mr. Duncan's temperature, and he didn't have one when he got on the airplane.
Right.
I think that he may have lied on a questionnaire. I think it would be a very good idea to not allow people to come from these affected areas, at least not without a period of quarantine.
All right. Also, the CDC said yesterday, the head of the CDC could not rule out, as we've talked about before, could not rule out that this will turn into an airborne disease. What is your evaluation that maybe in some places within Africa, it already is airborne, or that it could become airborne? How big a threat is that?
I think there's a lot of confusion about what the term airborne means. If somebody coughs on you or vomits on you, is that airborne? I think they're talking about the virus surviving on really tiny particles that remain suspended in the air. And there is some evidence that the virus can remain active when just going through the air. There's animal evidence that this occurs. The World Health Organization recommends that patients be treated in a BSL 4 level facility, which we don't have here except at USAMRIID and the CDC, or maybe a couple other places.
All right, so we're talking, not to interrupt, but I only have 30 seconds left. So we're talking about, when I say airborne, and when you're describing, I think, is like the flu, airborne like the flu. If somebody sneezes or coughs near you, it could stick around in the air. If you breathe it in, you could get it. That's what I mean. Is that where we could be going?
Well, we could be going, or we could be there. It just depends on how long, and whether you need to have a respirator and a self-contained air supply when you're dealing with these patients.
Yeah. Dr. Jane M. Orient, I thank you so much for coming on, and we'll keep in touch with you. Thank you.
Thank you.
All right, folks. Could be airborne already, or it could be airborne eventually. Give Me 5 is next.